Surrogacy Center. I'm a 4-time surrogate mom myself, and I have an online radio show on Blog Talk Radio called the ABCs of Surrogacy. Welcome, you guys. We also have a satellite office in San Francisco called San Francisco Surrogacy Center. We recently just rebuilt our website to bring San Francisco and LA together. So when you go to our new website, it says the Surro Centers and SF in LA. So we've come together as a family as opposed to separate in the beginning. So after I was a surrogate twice, I went to work for an agency in Los Angeles, and honestly, I hated working there very much. And I was later fired, just so you know. I was fired in an email, actually not even in a professional way. So I had to decide whether or not I wanted to go to work for another agency based in LA and hate my job, or wanted to start my own. So that's how our agency got started back in 2010. So our agency is quite a bit different than a lot of them that you're seeing outside the door. But so our fee is lower at $12,500 for a domestic couple and $14,500 for international. The reason for this is the agency I used to work for was really high. They started at $17,500, which I thought was an astronomical rate. And then when I left, they went up to 22, and then back down to 20, which is what they're at now. I think that that's insanely expensive and that you're paying enough. Our agency also doesn't charge an extra fee for egg donation. So some agencies will charge you like $2,500 extra to get a donor. We're not charging you anything extra, and we'll handle getting you an egg donor should you require the assistance of one. Which makes sense, you know, we're one agency, why should you pay us 2 fees? So, and I know our agency is based in California, and we're here in New York, but California is pioneered most of the surrogacy laws that are out there, and it seems like once we do it in California, years and years later, other states will slowly follow suit. This year, because of the fact that there had been some scandalous agency owners that have made the news, the state of California made the laws even stricter, which I'm so proud. Now all of our contracts are required to be notarized by all the parties in final draft. Agencies in California can no longer hold in-house escrow. And no, on the panel, that lady said, oh, we hold escrow. No, not in California. She would not be able to hold escrow. She'd have to hire an outside escrow company that's not part of her agency to hold your money for your safety, or you do attorney trust or a law firm. At our agency, you have the choice of doing either of those. So you can either use an outside escrow company that we work with that's based in San Diego, or a law firm will do attorney trust. Our agency, because we have the 2 offices in LA and in San Francisco, it reduces the travel on your surrogate mom and your egg donor, which I think is really important as a recipient parent, because travel eats your escrow account very quickly. Because you have to buy your surrogate mom her air ticket, car rental, hotel, you know, gas, food, whatever. And when you're doing that, you know, over and over and over and over again, and you're gonna go broke. So our Northern California surrogate moms stay in Northern California, and our Southern California surrogates stay in Southern California. We're not transplanting, you know, surrogate moms and egg donors all over the place. So we're not gonna hook you up with a surrogate mom from Montana, because under the California law, surrogate needs to reside in California and give birth in California. So no over the state line or any of that at our agency. Our agency doesn't do traditional surrogacy. Some of you may have read my book, My Room Your Baby, Tales of a 3-time traditional surrogate mom. I love traditional surrogacy. I'm a 3-time traditional surrogate, as some of you who are maybe familiar with my career know. Unfortunately, the laws aren't supporting it right now. The lawyers that we work with yell at me, so no TS, unfortunately, at our agency. Wellness. Our agency is huge on wellness. I would say that we're laying that foundation for how your surrogate mom should be and how healthy she is. You know, my analogy in my consults with recipients is, you know, well, how healthy do you want your baby? I have not yet to meet one that says, I don't want a 100% healthy baby. And I'm like, well, why are you hiring that surrogate mom over there who eats McDonald's and looks, you know, not healthy? It's like, are you making the correlation to the fact that she may not be healthy? So what we're doing at our agency is we have hooked up with some of the leading experts in prenatal nutrition, preconception nutrition, and fitness. All of our surrogate moms get a pregnancy fitness kit that's included in your agency fee. So I'm not like making things up and charging you extra on the back end, which is something good to know, because a lot of recipients are, concerned about costs. It's a very expensive process, so you don't want me making up a bunch of fees and then charging you on the back end. So all of our surrogates are getting this fitness kit so they can stay fit at home. They're also getting preconception nutrition counseling because there's actual research that states when women are deficient in certain vitamins and minerals prior to conception, they're more likely to have pregnancy complications, things like high blood pressure, diabetes, like the doctor was talking about. And issues like autism and whatnot are traced to the closing of the neurotube, which starts around 3 weeks. So we want to make sure that your surrogate mom has the right vitamin and mineral levels prior to her becoming pregnant. So we're educating them on diet, monitoring them. We're going to be the first agency in the industry to get its own private physician. We're in the process of hiring one out of LA. So all of our surrogate moms will be screened by one physician that works for our agency, and then they'll move on to your RE. So we're taking it even farther with that. Personally, I think that the ASRM guidelines, which most agencies will tell you, that's like their safety net. We follow the ASRM guidelines. That's like the safety net of surrogacy. Those guidelines are way too loose. At our agency, we have taken the steps to tighten the guidelines. We're not taking surrogate moms over 40, even though ASRM says 45. In April, I released a press release saying that we would be the first agency in the industry to limit the number of cesarean sections our surrogate moms could have to 1, and encourage them to have vaginal birth after cesarean section, anyone after that, if should it be medically possible. The only time that your surrogate mom should have a cesarean section is for a medically necessary reason, and that saves you money. Having your surrogate have a C-section can cost you like $10,000. She gets a fee for that, there's medical expenses involved, there's downtime, there's lost wages, etc. The expenses really add up on C-section, and that's something that a lot of recipient parents don't realize because it's such a common medical procedure. And then her uterus, which is where your baby is growing, is becoming warm. Not only has she had a high number of pregnancies as a surrogate mom, like they were saying on the panel, some surrogates have been pregnant like 5, 6, 7 times. If you look at like research on like WebMD, 5 is a multi-pregnancy, which can often be high risk. So when you're taking surrogates who've been pregnant 5, 6, 7 times, that's too many times. And then when you're mixing that with a bunch of cesarean sections, so not only has she been pregnant a bunch of times, now she's having a bunch of C-section, her uterus and the walls of her uterus are too lax. They just can't handle that much. And then we're running the risk of unnecessary pregnancy complications that can be avoided by us just not using that surrogate. So we're taking even further precautions for our surrogate moms, not only for your baby, but for her well-being. And unfortunately, sometimes we have to tell surrogates, no. And they said, well, Dr. So-and-so said, or ASRM says, I can have 5 pregnancies and 3 cesarean sections, which is true. So know that some agencies, you're gonna get a surrogate mom who's already been pregnant 5 times, which is a lot, and up to 3 C-sections, sometimes more. So your baby's gonna be like pregnancy 6 and C-section 4. And that uterus, in my opinion, just can't handle all of that. And your baby's running the risk of having complications that we didn't have to have because we could have just not used her. So we're not doing that at our agency at all, and we're taking that extra level to strengthen our guidelines on surrogacy to make sure that your baby makes it as close to term as we possibly can promise. Unfortunately, sometimes things happen, especially if you have twins. Twins can come early, but our overwhelming goal is to make sure we get all the way to 40 weeks and we're growing the healthiest baby possible. Some of the things you may have seen about our agency is that we have baby product partners, like legitimate, amazing companies who have come to me and are giving baby products to our clients. It's the most amazing thing that I've been able to bring to our agency in April. It started with Organic Kids. They make this amazing stainless steel baby bottle, and she's also a parent via surrogacy. And she came to me and she says, I want to help this community of people who are having children via surrogacy just like I did. And she's donated products all through our website. You get a discount. We're in the process of starting our own store so we can further help you obtain everything that you need for a baby. And that's kind of our way to kind of give back to you even further and thank you for choosing our agency over the hundreds of others that are out there. We just want to do whatever it takes to make this process as smooth for you as possible and affordable and make sure that you get that healthy baby. At our agency, it's really not about the money because a lot of it we're pumping back in to make sure that your baby's healthy and reaching out to experts and saying, hey, how can I make this better? And that's the difference that you're getting at our agency. Questions?
If you have an early termination due to a genetic issue, where do you restart?
Well, their doctor needs to give her a clean bill of health. Usually there's like 6 weeks or more between miscarriage. You can start the process over as soon as she gets the okay.
Can you use another?
You can use another surrogate mom, or you can wait. It just depends on what
is the fee to you?
Oh, there's no additional agency fee to our agency at all. So whatever we get paid is what we get paid until you get birth. So I know some agencies are like, oh, we'll give you up to 3 matches, 4. That's how much you pay us no matter what. So you can. We also have a refund policy in the beginning. If for some reason you decide to adopt, or you just decide this isn't a good time, we'll give you a third of your agency fee back.
So realistically, what are the fees? I mean, that one would spend from beginning to end?
I'd say right now our agency is running about 85 from start to finish. That's with the lawyers, the doctors, our agency fee. Our surrogate moms are making 26. Our insurance premiums are super good right now with Obamacare in California. No policies can exclude maternity. So we're really kind of trendsetters on that as well. And our surrogates, the rate of insurance, the cost is actually half of what it was last year. So our recipient parents this year are getting much better insurance rates, which are keeping costs low. At confirmation of pregnancy, we reassess your cost estimate and see if we can save you more, and then we do that again at 20 weeks. So I'm always looking at your budget and trying to rework it down. So you have money for baby's college, preschool, crib, all the things a baby has. You don't want to start, your first day of parenthood banked.
What's your average length from the time you meet?
I would say we're going at about 14 months right now. So pregnancy is 9, and I would say the whole process is about 14 months right now at our agency. We're doing really, really, we screen our surrogates really well, and a lot of that they have prior to even being on that paper in front of you, so we already know that they're well enough to have IVF and whatnot, and they're already undergoing, counseling for nutrition, and we're already working on, making them healthier for you, and even if they're already healthy.
Which clinics are you using?
We use all of the clinics in LA. I have a list of my favorite doctors that we work with, so it just depends on whether or not you wanted LA or San Francisco.
And that's included in?
The clinic costs are paid directly to the clinic, but we have like a read sheet for all of them, and we'll go. And they have doctors that I think are good with surrogates, and ones that aren't so good, so we kind of have like we call it the blacklist of our agency.
So that's in part of that $85,000?
Yes, we'll include the doctor fee as well. So, but at our agency we have like a secret blacklist, and if I don't like you, we'll go on the blacklist. But it's usually because of the fact that surrogates didn't get pregnant timely, in my opinion, and somebody's unhappy, and usually there's a reason why you're on the list. Which now this will be on YouTube where they watch it, and they'll be like, oh, I'm on the blacklist.
Are your surrogates all in California?
Yes, we are pretty much. We've had a few out-of-state applicants, but by and large, we usually turn them down. So you'll get a surrogate from Southern California or Northern California, and that'll determine whether or not you decide you want to go to San Francisco. We work with the San Francisco doctor and staff. We have the same screening people in San Francisco as we do in LA. So we can do a full surrogacy at the San Francisco office or a full one in LA. So, yes.
You said that it wasn't enough just for the child to be born in California, that the mother has to the surrogate has to reside there?
Yes, and under the California law, the surrogate mom has to live and give birth in California. It didn't used to be that way 5 years ago. You used to be able to take like a surrogate from Montana and bring her to California as long as she gave birth there. The rights, lied with California, but unfortunately that's not the case now.
And what determines residency? Like how long?
I think she's still there 2 years. So she has to have a valid California driver's license, an address, etc.
It doesn't matter where the father,
No, it doesn't matter where the IP resides. Just that the surrogate gives birth and lives in California. So, and that's where you're going to get a very agency.
how many clients do you have in New York right now?
In New York, we don't
Actively or
have
passively?
we don't have any clients in New York directly, but we have clients all over the place. In the last 10 days, we've welcomed 3 recipients, so we're a very popular agency. We have a large social media following, almost 20,000 online. Some of them, people came up to me and said they followed me on Twitter. I thought that was awesome. So we're out there. But I don't think right now we have anybody in New York City.
How do you find your cert?
Usually they apply on our website, or they usually find us like on Facebook or some sort of social media, and then they apply to our. We just recently we started advertising, but there was a long lull that we hadn't advertised at all. Usually it's word of mouth. Our screening process is first your surrogate mom will fill out an application, and then she'll get a, oh yes, I'd like to move. I'll let you move to the next process. Usually I'll email them and say, hey, let's have a phone chat. Okay. And then we'll talk, and then I meet them in person. And if they're a first-time surrogate mom, they have to have a psychological evaluation. They have to have a screening by an outside doctor that's not a reproductive endocrinologist to make sure that we're checking for high blood pressure, any diabetes that she didn't know she had, things that exacerbate themselves during pregnancy. So, because a lot of people have conditions and don't know they have them. So we're checking for all of that. And then the next step, after she's through all of that, the next step will be we'll show her profile to a set of recipient parents, and then when that set of recipients picks her, we'll do a phone match where you guys will talk on the phone and exchange information, and then we'll all sit down and have a lunch and require all of our recipient parents at our agency to meet their surrogate mom.
One thing you correct mentioned is that your background checks too,
Yeah.
surrogate as well as a partner or spouse.
I follow them on Facebook, Twitter, background check them. I really spend a lot of time getting to know them. Either on speed dial on my phone, and I kind of monitor what they're doing without being creepy, but at the same time, being proactive. I want to know what's going on in their homes. We're going to their houses and checking them out. I like to have lunches with them, and coffees and Skype, and I spend a lot of time getting to know them because I'm at SF a couple days a month, and then I'm in LA, so I'm always able to interact with them, be there if they need something, attend to transfers and deliveries. I really want it to be a nice experience for you. And I do the same with our recipients. I spend a lot of time if you're looking for an agency where that personal experience is important, that's important to me. And if you don't want that at an agency, I'm not the agency for you. I'm gonna annoy the crap out of you with my messages and wanting to friend you on Facebook and talk to you. I'm just not that. If you're looking for a hands-off agency, I'm not it. And you'll be very, very miserable with my messages and things, asking how you're doing and how the dog is or whatever. You'll just be very annoyed with me. So if you're looking for that experience, this is the agency for you. And I got asked by a recipient mom who signed up last week. She's like, how do I know you're not going to get lost in the shuffle? I said, well, we haven't ever had a recipient. We're an agency that wouldn't get too big. It's like when we're at, I live and breathe our agency. I'm always trying to make it better. I think about it when I sleep. I think about it when I'm in the shower. I really spend a lot of time trying to make it better. And this is my agency. It's about the experience, about making the baby. Yes, I make money, but that's not our focus. So it's not McDonald's. We're not getting in, getting out, getting in, getting out. It's just not the premise of our agency. And I don't see us becoming this major, conglomerate agency. Todd, if you can't ever get in touch with him, Todd is my husband of 12 years and father to my 4 children. He's your next call. I always tell my clients that if you need something right now and you can't get in touch with me, he's your next call, and then we have staff after that. So he can get in touch with me because nobody wants to wait for somebody to call you back days from now.
You'll get her number and my phone, both our numbers.
And then our house phone. So if something happens, it's like all the phones are ringing at once. And I love that, but at the same time, it's like, all right, I got it. So, any other questions? Okay. Anything else? You're welcome. All right, I think we're done.
Thank you.